Hello everybody, this is Carlos and welcome to another video. In today's video, we're going to demonstrate how to insert an NG tube for feeding and the two-step methods. Before we start inserting the nasogastric tubes or NG tubes, we have to make sure that we are cautious about some of the following situations that might require the doctor or a specialist to insert these tubes. These are the patients with any facial, cranial, or basal skull fractures. If the patient lacks any gag reflex, if the patient has any varices in the esophagus or have any recent gastrointestinal bleed, if the patient is known to have any nasal or esophageal obstructions, immediately follow up from a lung transplant. So the patient just got a lung transplant, that is a contraindication. And if the patient has any spinal precautions, for example, inability to sit up in high Fowler positions, or they are in lock roll. So under these conditions, please check with the team, with the medical team, as these might be contraindications for nursing to insert the NGs. Once we follow up and none of these apply, then we can go ahead and start inserting our NG. All right, team. First, what we need to do is we're going to assess our patient, ensure there's an order for an NG tube insertion. And once you get the order for an NG tube insertion and the patient has been explained of the procedure, we are going to assess which one of the two nostrils are the better one for NG insertion. All we need to do is cover one nostril and ask the patient to breathe in from their nose. Then you're going to cover the other side and you're going to do the same thing, ask the patient to breathe in from their nose. At the end, you're going to ask the patient which one felt easier to breathe from, and that will be the more patent one, and that's the nostril that we're going to use to insert our NG. Next, we're going to go over our equipment. So to insert a tube for feeding, which at our institution, we make a very clear distinction, we are going to be using the Enfits, which are the beige colored tubes that have the purple connector, and this part here is the metal guide wire. We're going to have a dressing tray so that we can set up our field. We're going to have some sterile water to irrigate this and flush it because it's necessary. We're going to have a tape. Now, if your institution has the NG tape, which looks like a butterfly, you can use those. Here at our institution, we cut our own, okay? And we'll demonstrate how to do that, but it will look like something like this. Lastly, we need the purple syringe, which is for the Enfits. We're going to show you that there's actually three types of syringes that is in there. We have this one, the purple one, which is only for the feeding tube because purple to purple. This is your lure lock syringe, and this one is for IVs. They will not fit into that one. And the other one is where we have the piston, and these ones are for NGs that can actually allow the feeding for this. All right, team. Next, we're going to measure the length of the NG. And there is two steps that we can actually do this. There's a one step and there's a two step. The one step is the traditional step that you learn in nursing school. And we are going to start by the tip of the NG. It's going to go to the tip of the nose, to the earlobe, and down to the xiphoid process. And right here for our gentleman, it's about 55 centimeters, okay? So when we put that on, we're gonna grab a little piece of tape so that we can mark it. And this is the piece that is gonna end up right at the nose. When we need to do a two steps NG insertion, this one's especially for those patients who are are more drowsy, they are still breathing spontaneously, or patients who are in CCU or in some ICU patients. So we're gonna measure it twice. The first measurement is gonna be the tip of the nose to the earlobe, to the middle of the sternum, and we're gonna put a marking right there. And the second one is down to the xiphoid process, which we already measure. So for two steps, you should have two markings. For a one step, you should only have one marking. All right, team. Next, what we're going to do is we're going to set up our NG and our equipment. Since we already pre-measure our NG for feeding, right? We're going to have a dressing tray. You're going to have some sterile water. You're going to pour some sterile water right here, as you can see. And we're going to have our Enfit syringe. You will know that it is an Enfit syringe because it is purple and it matches the purple on the hub over here. First and foremost, This NGs, because they have a metal guide wire, this one you do not need to put lube or lubricant into it, because this piece of plastic over here, when it touches lubricant, it can get very, very sticky. Instead, you're going to flush the tube twice. The first time is going to be to lubricate the tip so that it goes in easily. The second time that you're going to irrigate is after the tube has been confirmed by X-ray in placement to remove the metal guide wire, and we will revisit this step. So let's start by flushing it first with 10 milliliters of sterile water, and you're going to notice that the tube comes in already with 2 ports. This one here already has the metal guide wire, do not remove it. The other port that is open on the side, this one will be for you to twist it on, and you're just gonna flush it and watch as we start to flush and irrigate this. The tube or the tip is gonna be touching water. You can also submerge it into it, and you're gonna see that once this chemical touches water, it becomes very, very, very slippery. Okay, and this is how the tube gets lubricated. All right, as we're ready to insert the NG tube, we are going to ask the patient to just tilt their head back, and we are going to start by inserting the tube slowly. Okay, so we're gonna tell Mr. Smith, we're gonna insert the tube, and when I tell you to swallow, you are going to try to swallow. Okay, so as the tube starts to go into the patient, this is the point where the patient might start grimacing because it's quite uncomfortable. At this point, you can ask the patient to start swallowing, or you can give the patient a straw with a cup of water and they can sip water. As they sip water, you advance the tube. If your patient is fluid overloaded, for instance, patients who are CHF, you can give them a straw and you can ask them to suck and swallow on the air, because that will still open the epiglottis, allowing the tube to go into the stomach rather than into the lungs. Okay, so when the tube starts to go in like this, the patient, Mr. Smith, you're going to tilt your head forward. As the patient tilts the head forward, it actually creates a curvature at the back, as you can see over here. I'm going to just move the mannequin's head a little bit. It creates a little curvature, and this curvature will guide the tube into the stomach. Why is that important? Because as you can see from here, anatomically speaking, the lungs are anterior and the esophagus is posterior. So when you do the curvature, it actually very nicely curves the tube to go into the stomach and avoid going into the lungs, which is very important. If we miss this step, this is how sometimes the tube goes in from the nose and comes out from the mouth. Okay, so as our patient starts to, we ask the patient to swallow and advance, swallow, advance, swallow, advance, and swallow, advance. All right, you guys already can see that the tube has come up from the stomach. Obviously, in a real patient, you won't be able to see this because we don't have X-ray vision. But in our mannequin over here, you can see that the tube has already ended up in the first spot of the nose over here. We are going to secure this part, okay? And this is the 2 steps that we're doing. We are going to secure our tube with, for our patient. And at this point, we are going to need an X-ray. So we are going to remove this part, and we're just going to affix the tube just temporarily. Okay, this one is a temporary measure. At this point, the patient's going to need an X-ray to confirm that the tube is actually in the esophagus. Once the X-ray is done, we'll continue from here. All right, so now your X-ray has been done. It has been confirmed that it is in place by the physician or the nurse practitioner, and there's an order that for you to start your fit, and it's okay to do so. For these patients, now that we have confirmed that it is in place and is good to go, we are going to advance it until the second part here. Okay, so what we need to do is we just undo the initial dressing. Okay, because this one here was just to hold the tube down. Okay, and you're just going to advance it more, and look what happens to the tube. It just keeps going down further down into the stomach. Once we have reached the second point, now you can use the dressing again,
and really secure it and coil it down. You can use a brand new dressing if this previous dressing has become non-sticky, or if this dressing is actually still good, you can keep using it and watch. It's very secure in there. Once this tube has been down in there, then we need to start removing the guide wire. In order to do so, we are going to grab another 10 cc's of water. I am going to use a little cup over here so that it doesn't drip all over, okay? But I want you to show you how it actually looks like, okay? So the second part is going to be to remove the guide wire. We're going to twist our syringe on, and we're just going to flush it one more time. Remember, this is already inside the patient, so you won't see any of this. But as we start to irrigate the tube again, you start to see. Now that we have flushed it for the second time, this second time the flushing is intended for the guide wire to come out. Once you have done that, watch how easily this metal guide wire should just come up. It should be no friction. It should just come out like butter, like a knife cutting on a hot butter, okay? Just like that. Once the metal guide wire comes out, then you can connect your feet into here and you can start your feet as per your order. Team, before we finish, we're just gonna secure the tube to our patient to minimize any tugging or anything. And this will also provide some additional comfort for the patient and prevent them from accidentally being pulled out. And that is all for our two-step NG insertion for the Enfit type, intended at our institution for feet only.